Frankie, go and get your horse from outside and put pants on.
Whatever, Mom. Okay. What's that? Oh no! Oh boy, my mom's gonna kill me. Have you been exposed to a tick habit? Oh no, that's... Oh my goodness. Oh my goodness, headaches, lightheadedness, pain.
What are you looking at?
Nothing.
What's that?
Nothing.
Frankie, what is this?
Mom, I kind of forgot to wear pants when I brought in that day.
Frankie, I told you to wear pants.
I'm sorry.
Let's go to the doctor. It might be Lyme's.
Hello, how are you today? What brings you in?
I've been feeling really tired and achy and just sort of, and I have a red rash on my leg.
Have you been in a situation recently where you could have contracted a tick bite?
Yes.
Well, based on your symptoms, there's a good chance that you have Lyme disease, and we're going to need to run some tests.
Okay.
Okay, I'll be right back.
Thanks. Come in.
Okay, so we're going to need to run some tests. Unfortunately, that means taking blood.
Blood?
It's the only way to detect what's making you so sick, but I promise it'll only take a minute. Don't look at it. Done. I'm just going to run these to the lab, and I'll be right back. The tests all came back negative except for one.
Is it Lyme's?
Yes, come into my office, and I'll explain the details.
All right, let's go. Thank you, doctor.
Have a seat. Lyme disease is a bacterial infection transmitted by deer ticks. The bacteria that is transmitted is called Borrelia burgdorferi. Lyme disease can cause muscle pain, fatigue, fever, stiffness, and swelling of joints. It manifests itself as a large bullseye-shaped rash. Lyme bacteria transmits the bacteria to the host organisms, where the bacteria then adapt to the organism's immune system and environment in order to grow and divide.
Is this curable?
If left untreated, Lyme disease can cause serious health problems that can affect the brain and nervous system as well as the immune system, and if it gets bad enough, even death. Luckily, we caught it early and it is treatable, so I have high hopes for the outcome.
How do we treat it?
I'm going to prescribe you some antibiotics that should help you feel better within 1 to 2 weeks. If you're not feeling better by then, I would like to have you come in for another visit.
Okay, thank you so much.
Goodbye, feel better.
Okay, bye. Go lay down, I'll bring you your medicine. Good job. Feel better, sweetie.
Thanks, Mom.
Now I'm going to show you a diagram of what happens when a tick enters the bloodstream. When a tick latches onto the skin, it enters the body and hides itself so that the immune system cannot detect it. Once the tick is detected by the immune system, it is unable to effectively attack it and instead launch a massive inflammatory response that causes damage to the body's tissues rather than killing the organism. This bacteria is called Borrelia burgdorferi. Once the bacteria is in the body, it starts to change its form by altering the protein, which will effectively hide itself from the immune system.
Hi, my name is Rebecca, and I had Lyme disease when I was 10 years old. My neighbors and I were playing tag in the woods, and my legs were exposed, which made them a target for ticks, especially since I was in tall grass. A couple days later, I woke up feeling very fatigued, tired, and sore. My mom took me to the doctor a week later because my symptoms had not gone away, and sure enough, it was Lyme disease. I remember it took a long time before starting to feel better because it remained undetected for a while. My advice is to always cover up when going into the woods or tall grass, and to always check for mysterious marks on your body. Thank you.